I have a single purpose in this tutorial. It's to give you a quick overview, a flyover of the main tools and the process that you're going to use to do situation analysis. So let's start at the beginning. You should be here on your dashboard and you have two downloads, right? You can see them here. The situation analysis template, which is a Word document, and then the rubric for situation analysis. So that you need to make sure to download these. They're kind of hidden here, as you can see. And then once you've got them on your disk, let's go see what they look like. First of all, open up the rubric. You're likely to find it a bit overwhelming. So don't panic, all right? Don't run away. I'm going to show you, basically there are 7 steps to get started with situation analysis. Let me see if I can bring myself back here so you can see my expression. And I'm hoping I have a reassuring expression. So here, we want you to describe the most important challenge you face in your work. Now, it's the one you want to work on, all right, in the movement. So you've had plenty of opportunities to do that. You should know by now what it is. You may have changed it, but this is when you need to really focus in on one challenge. Second, this is kind of a mind trick or mind exercise, is how to turn this challenge into a question. And we give you examples. We'll be working on that in the assembly and the workshops, in the experience sharing and the technical support. Third is where we break. Now, everyone can have an opinion. We analyze situations every day, right? Every day you look at a situation, you say, okay, this is what's happening, this is what's not happening. The difference here is we're talking about science. We're talking about public health. And so this has to be grounded in information and data. Now, the data and information you have available may not be perfect. Your experience may be important data. So what you know, because you work every day in this, in your district, in your facility, at the national level, wherever you are, can help you answer your question. But you need to figure out what your data is. Fourth, once you've reviewed all this, you've looked at your question, you looked at the information you have available, you need to figure out, okay, determine what are your key findings. These findings need to be backed up by the data. And what's actually almost as important, if not, in some cases it could be more important, is to recognize what you don't know. So as you summarize your key findings, what is it that you don't know to be able to fully answer the question, to better answer the question? And then we want you to think of simple ways to get that missing information. And last but not least, because this is not an academic exercise, this is not about theory or building something perfect. It's about doing something good enough that you can use it. That's the key, I would say. And that is to identify what actions can you take. So you can see here, you actually have the link to the template here to download, and then some more guidance. Now, the overwhelming part there's 8 pages of very small type guidance with different criteria. To go back to your to your learning dashboard, you have important instructions here, 2 key documents to help you. So this explains what you'll find here. And then what is situation analysis? It's many different things. Here's what we mean by it. Then you have the timeline for developing your situation analysis. We've shared this in the assembly, but you get it here too. Make sure to note these dates and to make sure you don't miss the deadlines. There's no extensions. So if you miss it, that's it. You cannot participate in the exercise. We explain what's a rubric. This is the document I just showed you, or the beginning of it, why there's a numerical scale. Let me show you what that means. So as you scroll through, so for example, you describe your situation, but there's, you can actually assess your level of work. If there's no challenge or question identified, then you haven't done your situation at all. We want that challenge or question identified. If an important challenge and question is identified, supported by compelling explanation of local situation, that's a 4. So we'll explain when that gets used and what difference that makes. Now, the rubric can be overwhelming, so I suggest you start with the template. This is the Word document, and this is where you are going to write. So it is not a fill-in questionnaire, even though there are some things to fill in, and starting with the title. Now, the funny thing is we see many really brilliant immunization technical people who do a great situation analysis, and they forget, this is highlighted in yellow, and they forget to add a title to summarize in one sentence with an active verb what you found in your situation analysis. So make sure you change this. Don't leave it as is. You don't need to put your name. This is recorded automatically. And then the first thing you see is the fill-in part. So country of focus, location, role, function, title, your challenge, and then the IA 2030. Let me just in case that's not immediately clear, some of you may not entirely be very familiar with IA 2030. Others know a lot about it. And then here is the part in red. So we ask you to write out the question you want to answer by analyzing your situation. So let me give you a quick example. And don't worry, I'm recording additional tutorials that go into much greater detail on each of these. But for example, if your challenge is that COVID vaccine uptake is low among healthcare professionals where you work, even though vaccines are available. So it's not the supply that's a problem. It's on the demand side. Well, what are the questions you could try to tackle with your situation analysis? And here are two examples. These are examples. Please do not copy and paste these. I know some of you may end up doing that for lack of time or whatever it may be, but still. So one question could be, even though vaccines are available, why is uptake low among healthcare professionals in my district or facility? So you try to understand why uptake is low, and you could do a survey, or you could look at existing data. You could look, who knows? It depends. What have you got available? What do you know? What do you not know? What are your data sources? Those are all criteria in the rubric. But you could also ask a different kind of question, which is, which districts and facilities have the highest level of hesitancy, that where the greatest number of healthcare staff haven't been vaccinated? And then maybe that could lead you down a different track. Maybe it's a specific area where there's a religious community, or where there's been a lot of misinformation, who knows, or where there was an adverse effect related to immunization that scared everyone. So what you want to do, what you're chasing after, is to uncover the root causes. And so when you go here, you'll see, we'll skip over part 1, which is a cover note presenting your situation analysis. And so you'll do that at the end, all right? Because you need to have completed the situation analysis, then you write a note to your boss. That's basically what we're asking you to do there. But first, you need to get into what is exactly your situation. So you see in red, what is the question that you want to answer? That needs to be in there, but you need, of course, to describe the situation and explain what's specific. So if you tell us there's a lot of vaccine hesitancy, that's a very generic statement. That's not going to be helpful to us or to anyone else. And it's not going to be helpful to you to understand what actions are likely to help you tackle your challenge. Part 3, this is where it gets a bit technical, is your data sources. So data sources can include your experience. You just have to be honest about the limitations of what you can know through experience. Experience is very powerful, but here we're looking at, do you have hard data? What's the coverage? What's the vaccination coverage for COVID-19 vaccine amongst immunization staff? If you don't know this, then you identify, this is something I don't know. And that's important that you don't know that. So maybe you're going to have to make decisions. And one of the actions could be, well, let's do a survey so we can know what that vaccination coverage is. You think through what your data sources are, because part 4 is you summarize what's the most likely answer to your question based on the data. And it's not just saying, I think this is what it is, or I think I found this. It's defending your finding. How do you persuade, make a good case that what you found is the right way to go, is the right understanding, given within the limitations. And we know, for example, with coverage data, it's always incomplete. There are all kinds of limitations. It may not be reliable. You still have to make decisions if coverage is something that is important to your challenge. And then once you do that, you have next steps. So once you present your findings, you see part 5 here is about next steps. Given what you know, what specific and actionable next steps will you take with regards to your challenge? That's what we want to know in this section. So think about it. You've worked through the steps, all right, of analysis. And finally, this is not, as I said before, an academic exercise. You actually want to take action. And the whole point of what you find, to go back to this COVID-19 vaccination example amongst healthcare workers, is what can we do about it? Now, this is where we actually will ask you to go back to the ideas engine, because if you have a difficult challenge, chances are you've tried the conventional things, the things that we usually do, and they haven't worked. So don't put next steps that are the same things you've done in the past that haven't changed anything with respect to your challenge. Of course, if there's something you have done that is successful that you do every time, use that. It's not innovation, doing something new for its own sake. It's really finding innovative ideas and practices that can inspire you. And actually, what's the Ideas Engine? It's a place where you have hundreds of ideas from your colleagues from all over the world who've shared their practices and ideas as well. And that's where you can go and draw them. So in the last part, and we do this so we can then show that this actually works. Remember, there's always, in any public health project, including an initiative like this one, we need to show the impact. What difference does the Ideas Engine make? And you can help us here and help yourself, because it can, remember, in the Ideas Engine, you'll find innovative ideas. And we ask that you reference them, you document them here. There's the ID number. We'll show you how to get that in the tutorial, and then the name of the author. This is also a way of honoring your colleagues. If their ideas and practices have helped you think of next steps that you can take against your challenge that are going to be helpful, then this is a great way to recognize that they have added something for you, that they have done something for you. So that, again, let me recap. You start by reading the article on the rubric and the template. Download the documents, then review the documents. Do a cold sort of read through it once, even if you don't understand everything at first. It is long. It's 8 pages. We'll share a short version soon, but it's definitely worth reading. There's a lot of guidance that will help you structure your thinking and therefore make it a lot easier to actually, if you spend a little bit of time with the rubric, you'll see that answering these questions in the actual document itself will be much easier than you thought it could be. Fill out each part. Now, the timeline is very short. Remember that we'd like you to have at least the outline, preferably a good chunk of your situation analysis done by the end of this week. So do not be too overly ambitious. Do not let perfection become an enemy of the good enough for you to use to inform your decisions and to identify next steps. Doesn't have to be a perfect case study or a perfect situation analysis. It just has to have enough in there that you can use it, that your colleagues can give you comments and feedback to improve it, and that you'll then be able to identify those next steps. That's what it's about. So think about it. Don't calibrate the amount of work that you're able to do. It doesn't have to be perfect, but it's better to do something, to submit something by the end of next week than not submit anything at all because you were too ambitious or you got lost in the details. It's really about the 7 steps that I showed you. Let me see here. Yep. Carrying them through, using what you have available. I hope this is a useful introduction. Thank you for watching this video this tutorial to the end. There will be more detailed recorded tutorials showing you really the different steps, how to carry them out, and those will be available very soon. Just keep your eye on your learning dashboard. If you see the percentage go down, that's actually good news because there's more guidance available. Thank you, and take care. And don't let this overwhelm you or impress you. You can do it. You're a member of this movement. This is about helping you in your critical work, the work that you do every day. Tackle the challenges, a challenge that has so far resisted your efforts, and we want to help you make that breakthrough. Thank you, and see you soon.